my recollection is that there was this tension between the good policy of expanding Medicaid and the politics of expanding Medicaid. And in that case, the good policy of expanding Medicaid overtook the concerns that were being discussed politically. Today, politics are trumping the good policy. So for us, within this community, just to give you a sense, and for Mercy, to give you a sense of what the expansion has meant, and I'm going to use revenues because that's a way of gauging volume and activity. Prior to the expansion of Medicaid, we were seeing between 6 and 8% of our patients were covered by Medicaid. This past year for the hospital it was 12.7%, and this year it is running 13.4%. So even as the program continues to mature, the availability, expansion, and access for those patients is also improving. In addition to that, we are now serving in our medical homes roughly 18,000 individuals who are covered by Medicaid. And in fact, we're going deeper than that. We've brought 2 practices together adjacent to the hospital, very close to our emergency department. And those 2 practices are specifically dedicated to this population, Dr. Bob Schultes and Dr. Monica Meeker. In those 2 practices, we have 2,200 of these individuals, and these are the individuals that are complex. These are the individuals that have chronic illnesses. To Ted's point earlier, and it was interesting, I had an example down here of a patient with dialysis. Patient who would come to the emergency room time and time again because that was the only way in which they could actually get access to their life-sustaining treatment. And by the time they got to the emergency room, it was a train wreck. They needed so many more services. So fast forward to today, and I'm going to use the example of a young gal named Antoinette. Antoinette is a patient of Dr. Monica Meeker. Antoinette presented herself to the emergency room on multiple occasions. We were able to refer her to Dr. Meeker's clinic. While she is in that clinic, what she now has access to, because we understand the complexity of these patients, we now have a dietitian, we have a pharmacist, we have a social worker, we have a psychologist, we have access to legal services that will enable individuals to deal with their own living conditions. These individuals require so much more than what perhaps you and I in this room experience as healthcare, because their lives are really brittle. So the program has enabled us to step into that space that wasn't being served that well and provide these necessary, vital services. What I will say is it's not perfect. There are structural issues, but the way to address those structural issues is not to diminish the access that those individuals have to what they now are able to access. The way we work on that is by building stronger partnerships within the state of Iowa, and I think we can do this. We've done this before, we've demonstrated it before, and develop a system that can take care of this population even more effectively than we are today. So.
Okay.